Our goal is to get to level 5 communication. Remember, level 5 communication is feelings and needs. We want to get to feelings and needs in our relationship with the patient. Some of the ways to do that is through their referral source, being connected through their referral source. Other ways to do that is through just common ground, you have children, I have children, we both love the Yankees, whatever the common ground might be, all right? Getting common ground. How they feel about dentistry, what are their goals for their mouth? Those are great conversations to have around dental care. And don't be afraid to ask them questions like, when you're shaving in the morning, what kind of things about your smile do you not like? What would you change if you could? But let me just, I mentioned this earlier. You can have a conversation about likes and dislikes, and that is a level, that's like the first 3 levels of conversation. Likes and dislikes are like opinions, like facts, like cliches, but not a bad place to start. But then as you get deeper into feelings and needs, what do you not like about that? How does that make you feel? What would you feel like if it were different? Then you're beginning to get into level 4 and 5 communication. You can take your level 3, their opinion level, and move into their feelings and needs. Does that make sense? So it all works together. You need it all, but just be aware that where case acceptance lives is in 4 and 5. That's where you're heading for. Yeah?
Who is responsible to get to that level also? Because if I'm going to be asking, I'm going to get to level 5 with the patient at the front desk, and then he goes into the room, and because it's a fast practice, the doctor is going to go up again through the whole process.
No, you have to transfer the power. You have to transfer all the great stuff you've learned to the doctor, and you have to do it in front of the patient. So let's say you walk back with that patient, or maybe the patient's back there and you hop up out of your chair and you run back there because you know this is an important patient, and you say, Dr. Smith, Jane and I were just chatting at the front desk. Jane, can I share with the doctor what you said to me? I think it's really important for him to hear. And then you share it in front of the patient with the doctor. And talk about this with your doctor in team meetings and be prepared for this. My best treatment coordinators and people who are really discussing, because here you see them in the beginning and then you're seeing them at the end, are up out of their chair, back in that treatment room, discussing things that the patient said to them, back, how's the appointment going, anything I need to be aware of? So yes, really, but you got it.
It needs a lot.
Yeah, it needs a lot. So that's your connection level. All right, the personal motivator. The personal motivator is that personal desire, intention, want that is going to have them bend over backwards to get what they want. All right? And so let's say they are at risk of losing a tooth, and they don't want to have a gap. And they feel like that makes them look sort of like low class. How would you feel about yourself if you had a gap there? How would that feel for you in your job? What do you think that would do for your chances of promotion? Is that what you want? So you're asking, those are intimate questions. You're not going to ask that of every single patient. That's why the understanding who your patients are is important. But let's say my friend with the Halle Berry smile. If you could have that, what would that do for you? How would that help you in your life? That begins to get into what their personal motivator is. Their personal motivator is what's going to motivate them. Okay? Oh, here's my smile makeover. I had a personal, this was April 20th, and this was April 22nd. And so you can see how gummy my smile was, right? It was also at the end of the day and a glass of wine or two, so. But anyway, you can see how gummy my smile was, and I wanted, I've been working in dentistry since '85. And I can't tell you how many dentists have wanted to change my smile. I wanted to change my smile, but I was afraid. I was afraid that it wouldn't work. I was afraid that I'd get something I didn't want. I was afraid it wouldn't look natural enough. I knew I needed to do gum surgery and have crown lengthening done, but I didn't want to go to 15 different people to have it done. I wanted one person to do the whole thing, and I wanted to be somebody I trusted. And I was in January at one of my clients' offices in Amarillo, Texas, and he said, okay, we were driving to the airport. He says, when you're ready to do your smile, I'm ready to take care of you. He says, what stopped you all these years? And I've known him for 10 years. I said, I'm afraid it won't all work. And I only want to do it with someone who can do the gum lift and who can do the crown lengthening at the same time. He says, I can do all, I have all the lasers, I have everything you need. She said, let's do it. I said, okay, let's do it. She said, don't worry, it'll be okay, I promise you. But anyway, and I did have what we call as emotional treasure. My emotional treasure was, my dad's 101, by the way, and it has a denture. And my mom passed away at about 80, okay, and she had a denture. And I did some consulting in some nursing homes for a while, about 20 years ago. And my heart went out to those old people when they lose their denture, or they couldn't, my mother didn't like to wear hers, and she's a very attractive woman, and it was embarrassing to her, and she thought she lost her beauty. And so I had all this, at the subconscious level, all this fear about being old and having my veneers come off and having these ugly little stumps and, having this horrible looking smile because I wanted that. And Dr. P, he got me to communicate that to him. He says, what are you really afraid of? And I'm afraid I'll be old and it'll be broken down and I won't be, and I'll lose it. And I said, I don't really know what I'm afraid of. I don't really think that's going to happen, but that's my fears. And he got into my feelings and my needs so I could communicate it. And I said this earlier, but I didn't really complete my thought. When you communicate those fears, what happens is they lift off. They disappear. Because it got recreated by another human being. And we can relieve people of their fears if we'll just listen to them and say, I understand. I appreciate that. We'll be here for you. You don't even need to give them a reason how you're going to handle it. So anyway, that's the story of my emotional treasure and my personal motivator. And I wanted, because I speak all the time. I needed to get it done. And I just love my smile. And he said I want to do the bottoms, and I said, no, let's wait. But now I'm going to do the bottoms. You like it? Yeah. It's pretty great, huh? I say, by the way, any dentist who want, I have the film of the crown lengthening on my phone. I had them film it. I love the science part of dentistry. I think it's so cool. Anyway, 201 transfer power is a critical element in staying connected. And anytime the patient changes person, hi there. Anytime they change from one person to another person, you must transfer power. And the power that you're transferring is the power of the relationship. So, for instance, if I'm with, your name is? Molly. Yeah, Molly. All right, Molly. And I'm transferring Molly to Iris. All right, Iris, what's your job in office? Oh, well, she's the office manager. All right. So here's Molly, and I'm the hygienist, let's say. All right. So, Iris, Molly and I have had a great hygiene appointment. Right, Molly?
Yes.
So transfer power is three ways. I'm talking to Iris, and I'm talking to Molly. It's like a ping pong match. I'm talking to Iris, I'm talking to Molly. I'm making eye contact back and forth. All right? And Molly and the doctor talked about the area in the lower right, the cracked tooth, and she is ready to go ahead and have that taken care of and get a beautiful porcelain crown on top. And it's all in treatment plan already put in there, and I'm sure she'll need a post-it for it.